After 2 years of having life just disrupted by COVID-19 and the death and tragedy that it brought along with it, we may be learning now to live with it in this new normal that society is going to enter.
Yeah, Dr. Gregory Poland is one of the top authorities on vaccines and the virus, and he is a professor and the head of vaccine research group at the Mayo Clinic. Good morning, Dr. Poland. Thanks so much for being with us.
Good morning.
Good morning. How are you all?
We're good. We're good. So, curious what your sense is right now. Are we learning to live with some level of COVID-19 and basically getting out of the pandemic now?
Yeah, I mean, we really don't have much choice, do we? The problem is that the emotional fatigue and sort of a cultural narcissism, to tell you the truth, is prompting us to start to make decisions too quickly, in my estimation.
Doctor, the Center for Disease Control still says that masks should be worn in schools, right? And then there's this thing, New Jersey, Connecticut, a bunch of other states, they're dropping that requirement. It causes some confusion amongst parents who say, do I or don't I send my kid to school with a mask? What's going on? Who's right?
Well, it's a matter of trying to project what's going to happen. We're still at a point where we're having 250,000 new cases a day. We've got 13,000 people a day entering the hospital. Since Omicron surfaced in mid-December, we've had about 100,000 Americans die, and the latest model is another 60,000 Americans will die in the next month. The way I liken it is sort of to a foot race. We're in the last laps. Why would you stop now?
So what's your opinion then? Do you think that these moves to remove these or to have these mask mandates removed, are they more of a political reaction more than they are people or states rather following science?
Yeah, I think you're right about that. I think it's premature. I don't think it's in the best interests of the physical health of these children or for any American at this point.
Well, and that's the thing. Everything has become political, even when it comes to the vaccine, right? I mean, we saw that kind of divided among party lines here. So that brings us to the next question about those vaccines. Do you think, you're the expert here, that we'll need to get shots as we move forward? And if so, we keep asking the question, crystal ball, how often?
Yeah, great question. No one knows. It really depends on, is another variant going to surface that could change everything? I mean, we've watched this movie multiple times and we seemingly don't learn very much about it. What we can say is the data are very, very clear here. Getting 2 doses of a vaccine and a booster, I'm speaking of the mRNA vaccines, is the thing you can best do in addition to wearing masks indoors to protect yourself against infection and disease, hospitalization and death.
Yeah, so do you think there's any value to some of these drugs that are coming out and being promoted as COVID-19 treatments, drugs like human ivermectin and hydrochloroquine?
Yeah, I mean, those have been well studied. There is no evidence for their benefit. By contrast, there are antivirals that will soon be available. They've been approved, but now distributing them is the issue. And oral antivirals that I think will be helpful.
Doctor, there's the big question that we keep asking, and that's how far away are we from kind of going back to life as we know it? If you look at history, you know this better than anybody. I think there was only one time that a pandemic was fully eradicated from the globe, right? So do you think we're going to enter that phase, or it's just kind of learning to live with some level of coronavirus?
Yeah, I think it will be learning to live. I mean, my best guess, and it's only that, who can predict the future? My best guess is that we'll start sort of ride this down to a low level, and then sometime in the summer or fall, perhaps with school restarting, we'll see another surge, likely due to another variant.
What was it, smallpox? What was fully eradicated? Was it smallpox?
Smallpox.
How did they do it, right? What can we learn from it?
Well, the interesting thing is people saw and believed the direct results of smallpox infection, and basically the globe was vaccinated.
Yeah, so do you think that for now then it'll just basically be like getting a flu shot?
Yeah, best guess is that we will, at a minimum, get an annual vaccine that will include both influenza and SARS-CoV-2.
All right, Dr. Gregory Poland, appreciate your expertise and your voice here, Chief of the Mayo Clinic's Vaccine Research. Thanks so much for being here, kind of clearing things up a bit. We'll talk to you again, all right?
My pleasure.
Thanks.